Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us on the program today. Up until just the last couple of years, hospitals, treatment centers, and scientific hubs and research projects, they didn't share information with each other readily about their cancer patients. Well, things are changing, and our guest in studio today is Doctors Brad Hesse and David Ahern. They're both with the National Cancer Institute, and they're here today to talk with us about Oncology Informatics. They both have written the book, Oncology Informatics, and we welcome them to Health Professional Radio. Hello, doctors.
Hello. Thank you, Neal. Hello. Thanks, Neal.
Thank you for taking time out and coming and talking with us today. Oncology Informatics. As I said, there was a time when nobody shared information. How is that changing, and how are you at the forefront of this change?
Well, why don't I go ahead and start? This is Brad Hesse. And where we're at right now, it's an interesting set of times. A couple of events have happened over the past, I guess about 5 or 6 years. One was the Hitech Act that was published. I think it was in 2009 that it was passed by Congress, and that's the Health Information Technology for Economic and Clinical Health Act. That's what really provided incentives for hospitals to start adopting health information technology. So when that happened, all of a sudden, for better or for worse, a lot of hospitals started picking up electronic health record systems and started growing their own electronic nervous system. So that's a very good, important time. So that happened. Then as we're proceeding forward, there are changes occurring on the side of oncology where we can start aiming ourselves in what the presidents refer to as a moonshot, that if we can just collect our data together, we can accelerate the way that we're treating patients, and we can accelerate the way that we're learning about cancer. So that's happening simultaneously. And as this is going on, we looked at this at the National Cancer Institute, Dr. Ahern and I, and we said, you know what, I think this is a really great time to reach out to some of the best experts in the field to find out where the bright spots are on how doctors are sharing information with each other, and then to create a blueprint as we continue to move forward on how to do that better for the service of patients across their cancer journey. So that's what I would add to that, and maybe Dr. Ahern could add something as well.
Well, Dr. Ahern, now that things are moving in a much better direction, and it's taken quite some time, what were some of the obstacles that were preventing this sharing of information?
That's a great question, Neal. A host of issues. Historically, information collected in healthcare systems, hospitals, doctor practices was largely collected on paper. There were paper charts and paper records. So there really wasn't any computerized system in place in most practices and most hospitals. As Dr. Hesse mentioned, the Hitech Act and the incentive through Meaningful Use program that was put in place by the CMS to incentivize doctors and hospitals to implement electronic health record systems has really changed that situation and that landscape, so that a majority of hospitals and doc practices and physicians have access to electronic health records now. So information is now in more structured formats and now available to be extracted electronically. However, many of the systems that have been implemented are largely not connected, not interoperable is the technical term used, meaning that the information is basically locked in those individual practices or hospitals and not able to flow across systems or to other hospitals or practices. So the goal now is to take advantage of the investment in these electronic medical record systems and find ways to connect the information and to build the structures that allow for data sharing, for data liquidity, the ability for data to move and flow. And it's a very important part of the moonshot approach that we more rapidly share information. And there's a bit of culture issue too, not just a technology issue, that historically hospitals and practices conventionally sort of looked at their own patients and the way that they do their work as different than another center, even across the street, in terms of methods or approaches. I think much greater recognition now. We need to share information to actually improve quality, improve healthcare outcomes, and that requires that we be less controlling, if you will, of the data. But that's a bit of a culture change, and we need to make sure that the expectations are that data sharing will occur.
Some of these practices and facilities being located in rural areas, do you find that being a factor, and is that being addressed as part of the cultural issue?
Certainly, if you're not, you don't reside in an urban area where there's access to an academic health system or a large hospital system or hospital at all, it may be difficult to receive the full range of care that you might need for a chronic illness or acute condition. There's a movement called telemedicine or telehealth, which is part of this informatics area that we're talking about, that is growing as well, where the ability of, where geography shouldn't preclude the ability for patients to have access to high quality care. And so we see the telehealth and telemedicine movement, which is sort of parallel to this data liquidity, data flow, using electronic record systems and interoperable systems. That combination could improve care for all citizens of the United States, if not in the world, where geography isn't a barrier as it has been. So we think some of these barriers, cultural, technological, geographical, can be minimized and overcome through use of technology and informatics.
Now, talk about the book that you've written. It's called Oncology Informatics. How does this book help physicians and patients understand? Oftentimes, you write, to a physician from a physician, and leave the patient out as far as understanding it. It may be a great step forward, but is this book aimed mainly toward other healthcare professionals and specialists, or can we as patients get some insight into this new sharing of information as well?
Yeah, I'm glad you mentioned that, because one of the first things that we did when we decided to create this book is that we said, okay, there have been a lot of books developed for very technical audiences before, and that wasn't our purpose. Our purpose was to help the different stakeholders in care kind of get onto the same page as to what the potential is here and what the possibility might be of a really connected healthcare system. So the very first thing that we did is using some patients that Dr. Vecjord, who wasn't able to be on the call today, but was a third editor of the book, some patients that she had connected to is that Dr. Ahern and Dr. Vecjord did a focus groups with a lot of patients, asking them, how are you using technology in other aspects of your life? What are you doing when it comes to banking? And what are you doing when it comes to entertainment and consuming? And then how can we kind of apply those principles over to the world of what we want to do in caring for you as cancer patients in clinical care? And we've cited those patients repeatedly in almost most of the chapters throughout the book, because that became the starting point for us as we went through here. We also reached out. We have several places where we've embedded the comments directly of others who read the book and gave us comments on that. There's a patient, her name is Janet Freeman Daly. She's also helped us with something we'll discuss a little bit later on, perhaps, on a panel that's giving recommendations to the president on connected health. And she has a whole section where she talks a little bit about her care coordination story, where the problems were and what her hopes might be for how a connected system could help give her better connected services and a better continuity in what she does.
Where can our listeners go and get a copy of this new book, Oncology Informatics, using health information technology to improve processes and outcomes in cancer?
I think the two places that probably make the most sense would be either to go to the Elsevier site. So if you were to Google our publisher, which is Elsevier, and find their connection, you'd be able to get a look at the book itself, or even Amazon.com has a copy of it that you can look at.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Doctors Brad Hesse and David Ahern, both with the National Cancer Institute, and they've been here talking about Oncology Informatics. Transcripts and audio of this program are available at healthprofessionalradio.com.au. You can subscribe to this podcast on iTunes and also at hpr.fm. Thank you, doctors, for joining us today.
You're welcome.